Now, biomarker testing is not only important for patients with advanced or metastatic disease, but now we even have approved targeted therapies for patients who've had cancers that were surgically removed. And here, again, I'll refer back to the NCCN guidelines to talk about biomarker testing for EGFR, ALK, and PD-L1 as being absolutely essential for patients who've had surgically resected lung cancer or who are being considered for surgery. And really, this is born out of two very important studies that were recently published. So this is something called the ADAURA study. And here, what the investigators did is they took patients with a very specific type of non-small cell lung cancer called EGFR sensitizing mutations, and patients had surgery. Patients could get chemotherapy if it was appropriate, and then patients were randomized to osimertinib, which is an EGFR-specific drug, or placebo, which would have been considered standard of care. And overall, you can see that there is an improvement in overall survival if patients were on osimertinib than if they got nothing else after chemotherapy. And again, this is now approved by the FDA. It's in our guidelines, but we wouldn't know how to deliver this appropriately if we didn't look for the biomarkers. Very similarly, and again in ALK non-small cell lung cancer, the study called ALINA took patients now with ALK non-small cell lung cancers who had surgery. The study is a little bit different as it randomized patients to either the ALK TKI or tyrosine kinase inhibitor, an ALK drug called alectinib for 2 years, or chemotherapy, which is important and considered standard of care for 4 cycles. Here we don't have yet the overall survival as patients are thankfully doing very well, but you see that as compared to chemotherapy, alectinib offered a much longer disease-free survival, meaning the alectinib is leading to patients living longer without evidence of the cancer coming back. And again, this is now approved. So if we think about patients now who have a surgically resectable, so meaning that a surgeon feels that they can safely take out this lung cancer, biomarker testing and PD-L1 testing is important. Because if the cancer does not have the EGFR or ALK biomarkers, patients can get something called neoadjuvant chemo and immunotherapy, meaning chemoimmunotherapy given before surgery. Now, if we know that patient either has EGFR or ALK mutations, then right now they should undergo surgery and then get either chemotherapy followed by osimertinib for the EGFR mutated non-small cell lung cancers, or they should get alectinib if they have the ALK mutation present.